Hi, my name is Mahalet, and I will be doing a video to show you how to do administer injection subcutaneously. First thing I would do is gather my materials, which I have here. I have my thing in here. And then verify the six rights of medication administration: right patient, right drug, right dose, right route, right time, and right documentation. And I'm gonna go ahead and calculate my dosage calculation that I will be administer. So I have 1,000 units heparin subcutaneous per dose, and the dose I have in hand is 10,000 units per 10 milliliters. So I will do my calculation that I end up getting 1 milliliter per dose. And then after that, I'm gonna go to my patient and introduce myself. My name is Mahalet. I'll be your nurse today. They can let me in, and then I'll get the consent from the patient. I'll provide a privacy, and after that, I'll use my two identifiers. I'll ask the patient to state their name and date of birth, and at the same time I'll be checking the wristband. And I'll ask my patient if they have any food, medication, or seasonal allergies, and I'll discuss the purpose of my visit with my patient. So I'll talk about the medication I will be administering. I'm telling that heparin is used to prevent blood clots from forming in people who have certain diseases or conditions, or who are undergoing to certain medical procedures. So that will increase clots to form. Some of the side effects can be redness, pain, bruising, or sores at the spot where the injection was given, or a hair loss. And their adverse effects, like some serious side effects, can be vomiting bloody or looks like a coffee ground, vomit stools contains bright red, which shows that active blood, or black and tarry blood in urine, and excessive tiredness, nausea, vomiting can be very the adverse effects. And I will tell my patients if they experience any of this side or adverse effects to let us know, so we can let the physician know and do our further assessments as a nurse. And then after that, after I discuss that with my patient, I will allow my patients, like I'll give them a time to ask questions if they have any questions to ask, or I'll give them some time to ask questions. And if they say they don't have any questions, I'm gonna be perform my hand hygiene, and then wear my gloves, and I make sure I provide privacy as well. And I did my dosage calculation, and I got already a 1 milliliter dose that I have to administer. And I will double check that with my MAR as well, to make sure there is any medicational errors. I would do that. And then now I'm gonna wear my gloves, and before I inject or administer my medication, I will let the patient know that they might feel a little stinging or burning sensation while getting the medication, while I'm injecting. So I'm gonna go ahead and show you here. Okay, I have my so I'm gonna go ahead and draw 1 milliliter air. Milliliter over here, and then I'm gonna go and inject. Oh, before that, I make sure I clean the tips for good, for a good 5-second clean it thoroughly. And then now I can put the air in and like inject the air in and get a 1 ml. Make sure there's no bubble or anything. Make sure there's no, it's 1 milliliter I draw here, so I make sure there is no bubbles inside. And then I'm just gonna put the lids back in just to prevent any needle stick injury if I'm going to my patient's bedside. And I have this. Okay, I'm gonna go. And the first thing before I inject my medication, I'm gonna assess the skin surface if there is any bruisedness, inflammation, or any edema noted in here. If not, I can just like palpate and the site and to see if there is any like tenderness or masses. And then now I have my alcohol swab. I ran out, so I'm gonna reuse this, but I pretend that I open a new one. And then I'm gonna go ahead and so make sure I have like fold the skin or a pinch, get my alcohol swab and circular motion, do it for like thoroughly. I don't know if you can see it. And I will have it. I will let it dry. I'm not gonna blow it or anything, and I'm just gonna fold the skin after it dries, and I can use 45 degree to 90 degrees. So I'm gonna go ahead and inject my medication. And as I insert the needle quickly, I'm just gonna release the skin, fold the skin, and then slowly inject. After releasing the skin, take this out and put a bandage or a gauze. Like I can do it like right. This should be done like right after I take out the needle. I'll just do this, just to give it like a very gentle over the side. Do not massage and apply bandage if it is needed. And I'm gonna do this, and then make sure to discard the needle, the syringe and sharps or sharp needle container. And now I'm gonna remove my gloves and perform hand hygiene. I'm gonna ask if my patient is sitting in a comfortable position, and then I'm gonna go ahead and document my my findings, how I administered, if the patient was cooperative, and if the patient was not like guarding, grimacing, or anything while I'm giving the medication. And after 15 to 30 minutes, I go back and assess my patients to see if they have or experience any side effects. And before I leave the patient, I also want to make sure that I told them again if they experience any of the symptoms, or if they have to call us, or if they have any questions. Usually they might have a question after administering the medication, so I'll ask them if they have any questions and document my findings, document that I administered the right dose, and that I checked, and if the patient was tolerated well or not. And I will undo privacy, wash my hands, leave the room, and do all the documentation I mentioned earlier. Thank you.